Yeah, please confirm the audio quality. Let me know if I'm audible or not. Also, if you want me to rise the voice, I can do it. So please confirm the audio and video streaming. Let's go ahead with our case-based discussion. Okay. I can do it. So please confirm the audio and video streaming. Let's go ahead with our case-based discussion. Okay, I just confirmed it from my device, so it seems to be streaming fine. A very good evening, each and every one of you. Welcome to our session 3 of case-based discussions made easy. So in this live session, we'll take up another case or context, and then as we have improvised our session, we'll add up 5 questions to this particular context and then try to discuss the same. So each question, we have a weightage of +4 if you answer it right. If you answer it wrong, -1. So the total score of this session is 20. So by the end of this session, you'll get to know your score. You can analyze your score and drop your scores in the comment section. Okay? So I hope you guys are all ready. And also, before we start, the objective of this session is to make sure that we are dissecting these case-based questions and we're trying to have fun in the process. If learning is not fun, then what's the point in doing it? So learning is fun if we're doing it in a right way, with right orientation. Okay? So also, I'll just add this and then move ahead with our discussion. Before you attend any live session, make sure that you have your customized notes, right? So any point, any important point which you come across or which we try to highlight, try and make a note of the same. And this customized notes is going to help you enormously just before your exam, during your final revision. And I'm sure most of you are in your final revision phase. So this is the right time for you to get acquainted with as many additional key points as possible. There is nothing wrong in knowing more, isn't it? Yes. So let's go ahead. I hope you guys are all ready. So as I have been mentioning prior, we have these upcoming courses for NEET MDS 2022 as well as NEET MDS 2023, crash course and Mission 12 batch respectively. So you can check those details on our website, ptvdacademy.com. We'll start with the particular case or context. As you can see, a 14-year-old Asian boy whose favorite food is custard complains of abdominal discomfort and diarrhea with a feeling of bloating after its consumption. Upon performing hydrogen breath test, hydrogen value rises to more than 20 ppm compared with 0 or baseline. So this is the case or context you have. And the following are some of the hints which are presented to you in order to enable you answer this question. As I keep on reminding, case-based discussion, case-based MCQ is a format of MCQ where instead of asking you the question directly, they'll be giving you several hints. And you can catch on to those hints if you have some background information related to this particular case or context. So if you carefully observe, we're talking about the age, we're talking about the sex, and also we're talking about the region. We're saying Asian boy. And also you can see that custard has been highlighted. And the rest of the things, as usual, you have this clinical symptoms, abdominal discomfort, diarrhea, the feeling of bloating, flatulence after consumption of custard. And they've also mentioned about something called as, we have also mentioned something called as hydrogen breath test. So upon performing this test, hydrogen value rises to more than 20 ppm. So this is the information which you have. So Let's see what kind of questions you're getting exposed to, right? So do observe this context or case carefully, because based on this, you'll have to identify various key parameters or answers related to the subsequent question. So you've seen the age, the sex, the region, the food, the chief complaints, and a lab test. Okay, so I hope you guys are ready with a question. Can I proceed? So please do confirm. Or do you want more time to go through this particular case or context? Yeah. So 14-year-old Asian boy whose favorite food is custard complains of abdominal discomfort, diarrhea with feeling of bloating, and even flatulence after its consumption, and hydrogen breath test. The hydrogen value rises to more than 20 ppm. Okay, I can proceed. Thank you. So here is the first question. What the most probable diagnosis? Irritable bowel syndrome, lactose intolerance, milk protein allergy, fructose intolerance. Which one do you think is more appropriate answer? Irritable bowel syndrome. So we'll go through each of these options and see if we can eliminate any of them. Irritable bowel syndrome is a group of symptoms which occur together. Mainly, there is pain in abdominal region, along with changes in bowel movements, and there can be either constipation or diarrhea or both, right? So this is the information which I'm going to present related to irritable bowel syndrome. You have seen the context, right? So do you think this suits diagnosis? Do let me know. What about lactose intolerance? As majority of you have chosen option B, why do you think it is lactose intolerant? Can anyone give me a proper valid explanation? In the meantime, we'll go through other options. Milk protein allergy. Mostly, there can be milk protein allergy, especially with cow's milk in infants. So when we say allergy, we're talking about allergic manifestation, which is usually through cutaneous presentation, isn't it? Also, there can be other presentations, but cutaneous changes are quite evident in case of allergy. But in this particular case, we haven't mentioned about pruritus, rash, or anything of that sort. So milk protein allergy is a recognized problem in the first year of life. Cow's milk protein allergy is the most common of such milk protein allergies. So usually it can be seen in infants, up to 15% of the infants, according to one PubMed indexed article. And symptoms to this milk protein allergy include urticaria, rash, pruritus, also respiratory symptoms such as wheezing and coughing. We're talking about allergy. None of them have been mentioned in this particular context, right? So you can eliminate this option as well. What about fructose intolerance? So fructose intolerance is also seen because of lack of aldolase B enzyme in susceptible individuals, and they are unable to break down fructose or sucrose or cane sugar. As you know, we have different names. So because of which there can be, fructose intolerance. So fructose is especially present in case of sugarcane, as I mentioned. Symptoms of fructose intolerance, for your information, include convulsions, excessive sleepiness, irritability, yellow skin, poor feeding and growth of baby, problems after eating fruits containing fructose, and also vomiting. So none of these symptoms or clinical findings have been mentioned in this context, so you can rule out this as well. Yes. What about option B? As majority of you have rightly chosen, as Ignatius rightly mentioned, the hydrogen breath test. Usually, the hydrogen levels are more than 20 ppm in case of lactose intolerance. So that is considered to be one of the most important tests, but not definitive. So we can go for biopsy as well. We'll look into that a bit later. So given the context, the patient is unable to digest lactose. because of which there is accumulation of lactose within the bowel, because of which there is fermentation happening. Bacteria ferment this undigested lactose, producing hydrogen gas. This hydrogen gas will be absorbed into blood, the majority of it. Some of it comes out as flatulence, but majority of it. And the rest of the hydrogen gas can be used for producing sulfide and also short chain fatty acids, but majority of hydrogen gas enters through the lining of large intestine into the bloodstream, and then is exchanged in lungs and comes out in the form of breath. In fact, the most characteristic feature is in a person's breath, if there is hydrogen gas, the only source of that hydrogen gas is from the bacterial fermentation that's happening in the intestine or bowel. This is very, very important, right? So that can be considered as diagnostic. So as majority of you have rightly chosen, option B is right answer. Yeah, Staph aureus, age, and also if you look into the context, we'll get back to the context once again. Usually, a primary lactose intolerance is seen in case of, it starts in infancy, but it is mostly seen, rarely seen below the age of 5, and mostly seen in the age of, adulthood as well as adolescence. So 14 years, boy or girl, there is no such sex predilection, but in certain regions such as African Americans, Asians, Hispanics, this lactose intolerance is widely prevalent, and it is least prevalent in case of Europeans. So that's the reason why I mentioned this region also, right? And custard, as you know, it's made of milk, so lactose containing milk product, milk, cheese, cream. There can be some flour. You know how custard is made. So lactose containing food. So that's the point here. Upon consumption, because of generation of this hydrogen gas, which is being fermented within the bowel, leads to flatulence, abdominal pain, discomfort, diarrhea after its consumption. Usually it is in 30 minutes to 1 to 2 hours after consumption of milk containing products or dairy products. And hydrogen breath test rises to more than 20 ppm, which we'll see in this particular illustration which is coming up. So option B is right answer. Those who have chosen option B, do award yourself +4 marks. So this is the structure of lactose. It is a disaccharide, and lactose is the most abundant carbohydrate in mammalian milk. So lactose, it is a disaccharide, as I said, contains galactose and glucose. Okay. Yeah. And also this is the hydrogen breath test I'm talking about. Positive for SIBO, it's nothing but small intestine bacterial overgrowth. After performing this hydrogen breath test, if the level of hydrogen is more than 10 ppm, then we say it is positive for SIBO, that is small intestinal bacterial overgrowth. Only when there is bacterial overgrowth, only when there is fermentation, we get this hydrogen gas. If the hydrogen gas level exceeds 20 ppm, as you can see, then it shows that person is not tolerant to lactose intolerance. Okay, more than 20 ppm, above the baseline value, or as you can see, 0. So as I mentioned clearly, you can ask like how breath test is helping us find out or detect this hydrogen. So as I mentioned, because of remnant lactose, the person is not able to digest this lactose because of lack of one particular enzyme. I'm not going to name that enzyme because we have a question on the same. So because of deficiency or declining levels of a particular enzyme, the lactose containing milk or dairy products which are being consumed, they're not broken down to galactose and glucose, and hence they're not absorbed by our small intestine. As a consequence, they're accumulated within the bowel, where they are fermented by the bacteria, as you mentioned, the microorganisms, leading to production of hydrogen gas, some of which escapes as flatulence or flatulence, some of which is utilized for making several chemicals, but majority of it crosses the lining of large intestine, absorbed into the blood, and then travels to lungs. From there, there is gaseous exchange and comes out as breath, expelled as in the form of air. So the hydrogen gas which is present or expelled in breath, the only source of this hydrogen gas in breath is the fermentable bacterial. It's because the bacteria are fermenting this lactose or any other product in the bowel. So the only source of this hydrogen gas in the breath is the bacterial fermentation that's happening in the bowel. So that's the take-home message for you. So this is all for your understanding, okay? And also in the process, we have discussed about hydrogen breath test and its interpretation. I hope it's clear. If you need any further clarification, of course, you can refer to the study material which we'll be uploading to your e-classes. You will get even extensive information out there. I hope it's clear. Option B is right answer. Now let's move on to the next question. The reason why I haven't mentioned the name of the enzyme is because you have the question on the same. I didn't want to leak the paper. Yes. So lactose intolerance is due to defect in the enzyme lactase sucrase beta galactosidase aldolase B. In fact, in one of the options I have already mentioned previously, aldolase B is something which is deficient in case of fructose intolerance, if you remember. I try to highlight that as well. So you can rule out option D. What about rest of the options? Since I have given you a hint. So in case of fructose intolerance, the enzyme aldolase B is missing. So there is no breakdown of fructose. Okay, let's leave it out. What about rest of the options? Lactase, sucrase, beta galactosidase. So majority of you are choosing option A. Some of you are choosing option C. I think it's equal proportion. Yes. So which one do you think is more appropriate answer? Is it option A or option C? See, in our live sessions, we'll also have multiple correct answer questions, multiple correct answer or multiple right answer MCQs. So you can expect them as well. I mean, those who are attending our live sessions might have got used to the same. So which enzyme is responsible for lactose intolerance? So those who have chosen option A, only option A, award yourself +2. Those who have chosen only option C, do award yourself +2, because it is both lactase or beta galactosidase. They are the same, different names, but the same enzyme. So those who have chosen both options A and C, yes, award yourself +4. Very good. So lactose intolerance is the most common disorder of carbohydrate digestion in humans, which is due to defect in the enzyme lactase or beta galactosidase, which is present in the small intestine breast border, which is lining the villi. Okay. Yeah. In fact, studies have shown that there are several studies indicating that majority of adult population, more than 50%, more than 60% of adult population have lactose intolerance. But the thing is, they can consume lactose containing products without much of the symptoms. Okay. But studies, epidemiology studies have shown that majority of adults have lactose intolerance, which is quite interesting because mostly it goes unnoticed. But sometimes it can be a problem, as in this particular case, leading to diarrhea, leading to abdominal pain. In even rare cases, it can lead to other manifestations, which I'll try to review before we conclude this session. Okay. So options A and C are right answer. So you can give yourself +4 if you have chosen option A and C. So less commonly, it can also present with headache, muscle pain, joint pain, mouth ulcers, urinary symptoms, loss of concentration. But most commonly, the symptoms include diarrhea, abdominal bloating, pain, nausea, vomiting, fullness, and flatulence, as we have seen in this particular context. So both A and C are right answers. Well done. Now let's move on to the next question. Lactose intolerance is diagnosed by which of the following tests or tests? In fact, you should be able to answer this right, even if you have no idea, because we have already presented something called as hydrogen breath test in this particular case or context. But let's see how many of you are going to get it right. So, lactose intolerance is diagnosed by which of the following tests? Lactose tolerance test, hydrogen breath test, stool acidity test, all of the above, none of the above. So which one do you think is a more appropriate answer? So option D, Swati, Shubhangi, Pooja, Nishwas, Ignatius. Good, keep trying. So first of all, as we already discussed at length, hydrogen breath test, ability to detect hydrogen more than 20 ppm, then we say lactose intolerance. Also, these bacteria in your bowel, small intestine and all, they ferment this lactose, which is undigested, and convert that into lactic acid. So the stools turn acidic, the pH drops. The stool acidity test can also be used to diagnose lactose intolerance. What about lactose tolerance test? You give lactose in liquid form to the patient and check his blood level, blood sugar level every 2 hours after consumption. Obviously, when a patient or a person is intolerant to lactose, it doesn't enter into their blood, and hence the blood sugar level do not increase, right? So that also proves or helps us in diagnosing lactose intolerance. As simple as that. You give lactose, but the person cannot digest it, process it, convert it into glucose, and absorb it into blood. That cannot happen. So the blood glucose levels do not rise even after giving lactose in the form of a test. So as majority of you have smartly chosen option D, all of the above is right answer. Do award yourself +4. Okay, good. Now let's move on to penultimate question. Secondary lactase deficiency is due to which of the following conditions? Primary is hereditary, usually starts in infancy, and by adolescence or by adulthood, most of the lactase or beta galactosidase enzyme is lost, leading to lactose intolerance. Primary. But secondary lactase deficiency, because obviously it's understood, right? There must be some infection or disorder, and as a consequence of which, inflammation, as a consequence of which the intestinal brush border is damaged. It can be inflammation, it can be infection, it can be diseases, right? Because of which there can be lactase deficiency, because the lactase enzyme is being harbored in those villi along those brush borders, which is lost in the process of damage due to infections or inflammation. So which of the following diseases or medication, as in case of antibiotics, can lead to lactase deficiency? So which among them do you think is more appropriate answer? Secondary lactase deficiency is due to celiac disease, chemotherapy, gastroenteritis, antibiotics. So which of the following has the potential to cause injury to intestinal mucosa? Let me give you one let me share one practical experience. I'm sure you also had one, a similar one, more or less. After you take medication, especially antibiotics, as you know, the normal commensal flora of your bowels or intestine, small or large, are altered, because of which you usually suffer from altered bowel movements, diarrhea-like situation, sometimes constipation-like situation. So it means the microflora there are being altered. So don't you think that has a potential to cause secondary lactase deficiency or intolerance, lactose intolerance? So I've given you one hint. So which one do you think is more appropriate answer? Very good. Sujay, Shubhangi, you're becoming more and more smart in the process. Rashmi, very good. So as some of you are wisely choosing all of the options, so you got the hold of the format. of our questionnaire. So all the options are right answers. So celiac disease, gastroenteritis, Crohn's disease, ulcerative colitis, chemotherapy, antibiotics, all of these have potential to cause injury to intestinal mucosa, causing lactase deficiency. Because it is secondary to a particular a disease or infection, we're calling it as secondary. I hope it's clear. So those who have chosen all, award yourself +4. And those who have chosen any one of the options only, award yourself +1. Okay. If you have chosen 4 options, award yourself +4. Final question. What do you think we should do? Treatment for lactose intolerance includes dietary modification, lactase supplements, both of the above, none of the above. So which one do you think is more appropriate answer? Obviously, lactose containing products are responsible for these symptoms, even severe symptoms in particular susceptible individuals. So do you think we should ask such patients to reduce intake of lactose containing milk or dairy products or stop them altogether? Or would you suggest any lactase enzyme supplements which are available in the form of tablets or drops? So which one do you think is more appropriate answer? Is it dietary modification, lactase supplements, both of the above, none of the above? So which one do you think is more appropriate answer? So let me review some information. So management of lactose intolerance. Obviously, if it is secondary lactase deficiency, we should try to correct the underlying pathology. That's understood, right? Also, there is something called as dietary modification, as we have been discussing. So lactose containing products, eliminating them or reducing them improves the symptoms of the disease. And the following products contain lactose and therefore should be avoided, which include custard, which is placed in your context-based or case-based initially, custard, pudding, margarine, butter, mashed potatoes, pancakes, waffles, whey, sour cream, ice creams, milk, cream, buttermilk, soft and processed cheese. Milk containing products should be avoided altogether or at least reduced, and then follow-up has to be done. So dietary modification definitely seems to be a smart option. What about lactase supplements? Even that can be done. So lactase supplements, lactase enzyme tablets or drops. So these contain lactase, which breaks down lactose in milk to glucose and galactose and helps the patient to tolerate lactose. So option C is right answer, as majority of you have rightly chosen. So let's see how many of you have scored 20 upon 20 in this particular session. And before we conclude, before I give you some homework questions, you have the following question. Who among the following has lactose intolerance? This is very, very important question. Very, very important, general knowledge question. Big Bang Theory fans would definitely answer this. Let's see. Who among the following has lactose intolerance? Do you want me to name them? Of course, fans would obviously know all the names. In center. So let's start from left and then left of your screen, then move to right. You have the following options. Extreme left, Bernadette. And then you have Howard, Amy, Sheldon, Leonard, Penny, and to your extreme right, Indian Raj. So who among the following has lactose intolerance? I'm not sure how many of you attending this live session do actually watch Big Bang Theory, at least one or two. So who among the following has lactose intolerance? I'm very, very happy to look at the right answer. In fact, I'm connected to you guys. Monica, Ignatius, Shubham, we are a true Big Bang Theory fan, without any doubt. Of course, it is Leonard, which is the right answer. See, often we see Leonard is lactose intolerant. They avoid all cream, milk-based protein, milk-based dietary products, etc. Shraddha, fantastic. So Leonard is right answer. So those who haven't started watching Big Bang Theory, at least allot 20 minutes to watch one episode per day. Available on Netflix and even Amazon Prime. It will definitely make your day. Yeah. Yes, of course, I'm promoting Big Bang Theory because I love it. I stopped counting the number of times I kept watching after 5 or 6 times. So now I keep continuously watching it whenever I get time. So these are the following. By the way, that's not your homework question. These are your homework questions. You have 3 questions. Number one, consumption of curd or yogurt is beneficial for lactose intolerant patients. That's a true statement. Justify. So on one hand, we're saying milk, milk-based products or dairy products should be avoided in lactose intolerant patients. But on the other hand, we are telling you here that consumption of curd is beneficial for lactose intolerant patients. Justify. And second question, what's the difference between primary, secondary, congenital, developmental lactose deficiency? I've just explained to you about primary and secondary. What is this congenital and developmental lactase deficiency? Find out and let me know. And what is FODMAP diet? For your convenience, let me expand it. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, polyols. So what is this FODMAP diet? Right? So these are the 3 homework questions. As you know, the concept here is to encourage active participation and engagement. Right? So all you need to do is find out the answers and get back through mail. We'll provide you the key directly through mail, through one-on-one interaction. And we'll not be discussing these homework questions in live sessions because we want you to find out the right answers through active participation and engagement, as I already mentioned. Okay. So many of you have been mailing your work. Monica, yeah, Shubhangi, and most of you are attending these live sessions. I would recommend others also spend at least 10 to 15 minutes time maximum. That's it. In a particular day, find out the answers and get back through mail for the key. Okay. So these are some of the questions which I wanted to highlight. It was lovely interacting with you as usual. Yes, Ignatius. I missed Howard's name. No, I didn't miss Howard's name. You can check back the recorded session again. I said Howard. I love Howard. In fact, I love all the characters. Yes, Ignatius. Leonard is a physicist. He is an experimental physicist. If I'm right, if I'm not wrong. Yeah. Okay. Oh, you're talking about, oh, Melissa is asking who's Leonard? Leonard is an experimental physicist. Sheldon is theoretical physicist. All they do is just spit and then scribble on paper. Right. So it was lovely interacting with you guys. And if you have any queries, you need any further assistance, always feel free to get back to mail 24/7. And tomorrow, I think, will be the last live session for this week. So I'll be seeing you tomorrow again at 9:30 p.m. Indian Standard Time. And wish you all the best. Love you all. And before I conclude, always keep these 3 factors in mind. It's all about working hard, working consistently, and most importantly, believing in yourself. I do understand that as exam is approaching for 2022 aspirants, I can understand how you must be feeling. But nevertheless, if exam is approaching, if you think of exam day, if it is not exciting you, if you're not feeling enthusiastic, then there is something wrong with your orientation, not your preparation, but with your orientation. Try to get that right orientation by asking yourself this question, like, why exactly are you preparing and what is that you're planning to achieve upon cracking the entrance? The very purpose of any entrance or any test is to analyze your performance, and it's an opportunity for each and every one of you, to progress the professional level. So once you have an opportunity, should you be excited or should you be worried? But unfortunately, majority of aspirants, as far as my knowledge is concerned, are worried because of numerous factors. But if you can make sure that you're excited about the day of exam through right orientation by asking yourself very basic questions and trying to get straightforward answers, you'll have nothing to worry about. In fact, you'll always stay excited for each and every day for that matter. So wish you all the best. Love you all. Good night. Take care. Yeah, you're welcome, Sanjay. You're welcome, guys. Take care. Bye.